A mobile clinic on border taxi wheels. City dwellers here are amazed by Dr. Frank's innovation. They are getting close and curious to know what's actually inside. This young woman is among a dozen of excited faces. On getting closer, she tells us this innovation could save hundreds deep in the villages away from the city.
Ku bantu abali ewalako n'amalwaliro kaba kasobola obayamba okubaddusaako naddala abali mu byalo kaba kabayamba ne kabatwalako mu health center ziri okumpi.
Really, we have people who are helpless, who can hardly have ambulances that can take them to the main hospitals. When we have people that can innovate like this, it is a very good innovation.
Dr. Frank says the motivation behind his mobile clinic idea was informed by the fact that many in his home district lack basic treatment, often very expensive and hard to access.
What were you scanning?
So now we are having our patient here. She has been having some vein problem, and usually when we're using the scan, we can be able to identify maybe some veins that are passing by. So this kind of ultrasound machine, which is portable, which can be used in rural areas, we have the machines as you have seen. It can be used to help pregnant women, women with challenges, men with challenges. Now we have hypertension, we have people with gastro problems. So the only problem that we are having is we need staff, and probably the challenge of setting this kind of thing. Because when we set this kind of thing, you need to have an expert kind of expertise. And then funding it, sustaining it, and having it working on and on is the problem we are facing around here.
So what kind of equipment is in this mobile clinic?
So we can run on AV, which is using batteries. Then we can use the same to use with the engine. So that is number one. Then when we get inside, that is we go to hard to reach areas. Now number two, when we have used like this kind of system, we have an examination bed whereby we can do, I could even say mini theater kind of. If someone has got a cart, probably if people are in accident, as we are waiting for the ambulance to take them, we can look after some of them.
In Uganda, while there has been notable achievements, challenges persist in healthcare infrastructure, including high patient loads and inadequate budget allocations for medical supplies. Dr. Frank's innovation could just be one bike, but if supported, it could put a smile on a million faces. Malcolm Musiime, NTV Weekend Edition.